The human eye does more than just capture the beauty of the world. It's a gateway to our innermost experiences, reflecting everything around us in vivid detail. Yet hidden within this window are silent threats, diseases that gradually erode vision without us even noticing. In Nigeria, uncorrected refractive errors, cataracts and glaucoma are leading causes of vision loss, affecting millions. To address this pressing issue, Hacey, through its Impact Health program, launched the Impact Health Optical Coherence Tomography (OCT) project at the Ophthalmology Department of the University of Ilorin Teaching Hospital. This initiative aims to make advanced eye care accessible to thousands, recognizing the technology holds great potential to revolutionize eye health.
Having this machine around has been very impactful in our patients' management in this clinic, and so many people have benefited from it. We have patients that have it done every month routinely after they have a particular injection given into their eyes. So the machine helps us to decide whether or not to go on with the injection, and also, of course, we're able to do training, teaching of these patients, educating our patients with the images that we get from the machine. When people are able to see what the problem is, it gives them better understanding, and of course they can comply better with their treatment.
Quietly, a significant transformation is happening in the eye care sector. Not through a new surgery or breakthrough drug, but through the introduction of the Optical Coherence Tomography (OCT) machine. This remarkable technology is already making a difference, with over 2,000 patients across Nigeria benefiting from it, including an average of 212 patients each month. Over 16 ophthalmologists, optometrists and technicians have been trained to use the Spectralis OCT machine, enabling them to provide essential ocular services to patients with conditions like diabetes, hypertension, sickle cell disease, HIV, AIDS, tuberculosis, preeclampsia and malaria. The OCT machine has become a testament to the power of technology in advancing healthcare, especially through the Impact Health project. Abdurrauf Ayodeji Yakin, 63, is a retired staff of the Kwara State Ministry of Environment living in Ilorin, Kwara State capital. He says the machine is of great importance to the clinic and people, considering the free service and benefits.
About last year, this happened last year, the right eye couldn't see again. So after going to many clinics in the town, I didn't get any positive results. So I have to come down to Teaching Hospital here. The machine is of great importance to the clinic, and I've taken the scan up to 4 different occasions, and I can see that it is very useful to the patients. The clinic is correcting nothing. The last time I came, I met another patient, came together. The woman told me that at the clinic in the town, it was on 30,000 naira. I was surprised. Then about a week later, someone said that it's not 50,000. But at Teaching Hospital, they corrected nothing. The first, second, third occasion, it allows the doctor to know precisely what is wrong with the eye, to know where to do the injection, because I've corrected the injection on 4 occasions. So it knows where to give the injection and how it is progressing. So if not for the help of the machine, it will be difficult for doctors to at least to know precisely what to do about the eye. I only pray for the donor. I don't know them, but I pray they mean the glory of God, they made the God's assistants in whatever they're doing, because they are seriously helping humanity by giving this out to the clinic. It is helping us. Where will I get 30, 40, 50,000 naira to do this count in the town? 4 different occasions, I just multiply 4 times by 50,000. It's a lot of money. So definitely it is of great help to the patients.
Ibrahim Faiza Damilola, a graduate of the Department of Physiology, University of Ilorin, and president of the Student Physiological Association of Nigeria, Ilorin chapter, is convinced that the initiative will save thousands of less privileged people out there with proper sensitization.
The OCT machine has actually been of a very great advantage to I and my colleagues and to some other people who have been coming to the hospital for the test. Some of my colleagues were detected with traces of glaucoma, in which, if not treated early, will lead to total glaucoma, and some of them have eye issues in which I don't even know of, but then they were actually diagnosed with eye issues and they were advised to come for immediate treatment, in which some of them have been coming to the clinic for. And also the OCT machine have actually made me have a better knowledge of the position of my eyes. I'd like to appreciate Hacey for facilitating the use of this very great machine. I say a very big thank you to them, and may the organization continue to grow, may it continue to expand. To those watching this who haven't heard of the OCT machine, I'd like to say the OCT machine is available at the ophthalmology department of the University of Ilorin Teaching Hospital, UITH Ilorin. So please come, get your eyes checked, come make use of this very good machine. It is totally free, no charges included.
Another beneficiary, Alhaji Dauda Bolagade Salautin, a long-time cataract patient, says the machine has been so helpful with proper check on his sight.
The nature of my job caused my eyes issues. I used to see clearly before, but at some points, things changed with my sight, and that was what led me to this hospital. After I carried out series of tests, I was referred to do an OCT test. I really appreciate Hacey Health initiative for bringing this OCT machine to Ilorin. I have been doing it free of charge. This is my second time of doing the test here, and I never pay any money since I started doing the test. If we can have many health initiatives like Hacey, it's going to go a long way in helping the less privileged. Thank you, Hacey, for doing us this good.
Mary Alo shares her experience, providing that with the help of the OCT machine, our eye condition was detected early, allowing her to manage it more effectively.
Me ríran dáadáa, then ó máa ń hún mi, ó máa ń gún mi, ó sì ń pọ́n. Even tẹ́lẹ̀tẹ́lẹ̀ gan, bígbà tí wọ́n fi bígbà tí nylon kan cover ojú mi yìí.
Before I got to know about the OCT machine, I barely see things clearly. I cannot read, watch movies, and even to use my phone is a big problem. Everything will just look so dark. I have never paid a dime since I have been coming here for OCT tests. I heard that other hospitals collect 50,000 naira or even more to carry out this test, but here, I have never paid a kobo. It has always been free of charge.
So ìrànlọ́wọ́ gidi ni wọ́n ṣe fún wa láti ṣe fún wa ní ọ̀fẹ́. Ó ràn mí lọ́wọ́ torí pé kíni ó ti yàtọ̀ sí ti tẹ́lẹ̀, so ìyàtọ̀ ti wà, so ó ràn mí lọ́wọ́ dáadáa. A dúpẹ́ lọ́wọ́ àjọ Hacey.
Hacey Health Initiative has really helped me a lot because my sight is very normal now, unlike before. Now I can read, I can watch movie, and I can use my phone anytime I want. I want to use this medium to appreciate Hacey Health Initiative for their support with the OCT machine, and I pray that God will always uplift them. My advice for others is to visit hospital whenever they notice any unusual in their eyes. They should stop self-medication, as that can only damage their eyes beyond normal.
Ríran ó lè jẹ́ pé lóòótọ́ ó kù díẹ̀, ṣùgbọ́n a dúpẹ́ lọ́wọ́ Ọlọ́run, a sì dúpẹ́ lọ́wọ́ wọn níbi tí wọ́n ràn wá lọ́wọ́ dé. Ọlọ́run náà ò ní jẹ́ kí ojú ẹbí wọn fọ́ dànù, a dúpẹ́ lọ́wọ́ wọn.
In Kwara State and beyond, the OCT machine represents more than just advanced technology, it's a symbol of hope. This vital tool aids people from all walks of life, offering crucial services from diagnosing glaucoma to managing retinal diseases, and is making a profound impact on lives with every scan. The impact of the OCT project reaches further than just the patient. It has also trained over 16 dedicated professionals, enhancing their skills and expanding their expertise in utilizing the technology.
This machine has been very useful to us, like I said, in managing our patients, in making diagnosis, in monitoring their progress to treatment, and of course in screening out some people for certain diseases, particularly glaucoma, which is like an epidemic now. Again, this machine has helped us a lot with training of our resident doctors. You know, we are able, what they read in the books, we are able to show them live using this machine. They are able to read the images, so it has helped a lot in the area of training, and of course you know, in other things like research and all of that. So the machine has been really awesome. We've even had people from the main university coming to run their tests on this machine, even though it's I mean, far advanced than the ones that we know. So with the training, we've been able to use it, and they have gotten better on it using the machine over and over. So it's not like it's difficult to use the machine, and of course, because of the special features that it has, it's even a lot of improvements in managing our patients.
Some of patients that their glaucoma stage could not be detected early enough on the CVF, we may have to definitely ask them to do CT, and they have to travel outside Ilorin. Some patients have to travel as far as Lagos, and some centers that now has OCT in Ilorin at very high cost that they may not be able to afford it. So eventually, some patients still come down with a lot of damage before we now detect glaucoma using our CVF. But since it came, we pick out the glaucoma early enough and start treatment on time, thereby preserving meaningful vision and preventing blindness. The patient that will be thinking is borderline. With this OCT, we can easily say, correlating it with fundus findings, other findings as well, we can easily say, oh, this patient has glaucoma, and we can start treatment on time, and thereby preserving meaningful vision and preventing blindness. On the part of the patient, accessibility, something that is not accessible to them before in Ilorin, now accessible to them. They don't have to travel outside UITH. They don't have to travel into town, and at no cost. You know, it has made the life of our patient also meaningful.
Since the donation of OCT into this facility, a lot of patients have benefited, which we are very grateful for. And then this donation has actually revolutionized the treatments and also the diagnosis of patients in our center. So we want to thank you for your support, as we can now diagnose some optic nerve and retinal conditions conveniently in our center, because of the donation, we can now monitor patients for some specific conditions conveniently, and also its donation has also improved our patients' interaction, such that we can easily get down to the patient and explain their condition. So it has made the patient education conveniently. It has made it possible for us. On the part of the doctors, it has reduced our referrals to other centers. So now we can carry out in-house investigation. So we are forever grateful for that. And this donation has actually impacted on so many people, on so many lives, as this has improved their treatment.
This machine is very easy, Amazon. It's very easy machine. The difference because the one we are using is not like digital. The one like glaucoma machine is like digital too, but it's not wide like this one. Because this one shows us some area and there's very easy operate machine.
Dupe Ademola Popola, a professor of ophthalmology and chairman, head department of ophthalmology, University of Ilorin and Teaching Hospital, describes the Spectralis OCT machine as a game changer, highlighting that it is a non-contact, non-destructive and delivers high-resolution images.
OCT machine, the Heidelberg OCT machine, the top of the grade, really to us was answered prayer. To the hospital, to our patients who have benefited tremendously from this, and even our resident doctors and the consultant, because this was new for us because we had a different product before. It gave us the needed exposure to this top of the range machine. It gave us the opportunity to not only do baseline tests, to also follow up our patients, and we're able to more confidently diagnose and manage some clinical conditions. So we are very grateful for this great gesture and opportunity. One other important part of this initiative is it came fully ready, power backed, and there almost whenever we needed it. It was backed by solar inverter system, such that there was no reason for it not to work. And we are really grateful that we were considered the hospital to have this, because we are really the best in the country, you know. And anyone who is supporting us, you know that you're really supporting great value. It's such a great financial support to our patients, because it's been free to the patients. So it's a super impactful thing. To talk about how many people have benefited, even though I mentioned over 2,000, usually for things like this is multiplier. Why? This machine helping us to make some diagnosis has helped us to trace several family members. To say, oh, what we are seeing in your eyes, you need to bring your other family members. So it's helped us to be able to diagnose at an earlier stage some of those disease conditions. And we're still looking forward to following up quite a number of them. So we believe that this machine is here to stay.
Professor Dupe Ademola Popola noted that the machine has boosted patient confidence and impressed international colleagues, though there remains an urgent need for an operating microscope in our department. Oluwaseun Oladoye, the project manager of the OCT project at the University of Ilorin Teaching Hospital in Kwara State, explains the capabilities and impact of this advanced optical coherence tomography OCT device are so enormous. Oladoye notes that the machine, which functions like a camera, capturing high-resolution images of the entire eye from front to back, assists doctors to accurately diagnose and manage patients.
The output is so easy to make use of, to the extent that it's does a form of delineation, a form of classification by itself. And so if the eye is normal, it has a color code. If it is below normal, it has a color code. If it is above normal, it has a color code. So it makes it easy for the doctor to be able to make his own assessment and then manage the patient effectively. And so we've been here for about 10 months now, and the OCT machine here has served over 2,000 people of all ages across cities and towns of Nigeria.
This cutting-edge device is reshaping the way eye conditions are diagnosed and treated, bringing clarity to those who have lived in darkness. It has served people from all walks of life, detecting glaucoma, managing retinal diseases, and supporting those with chronic conditions.
It has served people across ages and across regions of Nigeria. People have come from Osun State, people have come from Lagos, people have come from Niger State, people have come from the FCT to have this test done. People have come from the north to have this test done. So it has served people across all regions. At the same time, one great benefit of this spectralist machine is that it's simplified in its design, and so it's easy for the operators to make use of, and at the same time it gives high resolution images. The output is of high resolution, and so that's one of the great benefits of the spectralist machine. At the same time, without any form of preparation or so, within 5 minutes, you can be sure that you'll be able to complete the OCT test for a patient. All the patient needs to do is just to put his forehead and his chin against the head rest and the chin rest. That's all the patient needs to do, and then the test is done, and within 5 minutes the patient is done, and there is no contact, there is no injection, there is nothing to insert into the body of the patient, and so it's more or less contactless, and so it gives out high resolution images that the doctor will be able to easily make use of.
The story of the Impact Health OCT project is one of restored vision and transformed lives, a clear demonstration of how technology can make a profound difference. Thanks to Hacey's effort and support from Iprd Solutions, this vital technology is now within reach for many who need it, ensuring they receive top quality eye care.
To Hacey, health actions concerning the environment and you, we want to say very big thank you to Hacey Health Initiative, because this machine has been very useful for us. So we are very grateful to Hacey Health Initiative, and we also want to thank Iprd Solution, who happens to be their partner in this great work. We say a big thank you to them as well, and we ask that they keep this up. We'll be open to more collaboration with them.
We are very grateful. The patients, the hospital, and the community we serve. In this hospital, patients come from almost every state of the country to access our service, and they all have had the privilege of using this machine. So what you have done here is not just for Kwara State, it's not just for this city, but it actually is been nationwide, because when it came, we actually advertised nationally that anyone who had a patient who does not mind to travel down should come and use it for free in Ilorin. So we are very grateful. We are grateful to the partners of Hacey Health Initiative, Iprd Solutions, for supporting Hacey to be able to do this.
The impact of this initiative extends far beyond individual patients, enhancing overall societal well-being. With continued investment in such technology, we can ensure that more lives are positively affected, making eye care a priority in Ilorin and beyond, and ultimately turning the tide on blindness for a brighter, clearer future for all.